So sorry about that. I lost internet connection with that big clap of thunder. So we'll get started here. Thank you guys for joining us this evening. We are happy that you're here with us and you are safe and sound and not having to drive in the thunderstorm this evening. We want to welcome you to our webinar, A Modern Guide to Breast Implant Surgery. We're going to be showing you our presentation by our board certified plastic surgeons, Dr. Matt Novak and Dr. Mark Mason. Before we get started, let me introduce our presenters. For those of you new to the practice, Southlake Plastic Surgery is the longest established and, of course, the best plastic surgery practice in the Southlake area. Dr. Mason founded Southlake Plastic Surgery 26 years ago as a reconstructive and cosmetic surgery practice before evolving into a purely cosmetic and aesthetic center. 9 years ago, the med spa was then introduced to offer patients a more expansive practice to offer more aesthetic treatments and non-surgical treatments. And then more recently, Dr. Novak joined us, further expanding and enhancing our cosmetic expertise and personalized care that we provide. You'll also hear from Samantha Oberholzer, our lead clinical nurse, and she's the one that takes care of all of our patients pre, peri, and post-operatively. And then you'll meet Kim Kohler, who is our patient coordinator, and she's been an integral part of our Southlake Plastic Surgery family for 14 years. So before we get started, you're going to have an opportunity to ask questions in the Q&A. You can see that at the bottom of your screen if you'll just type in your questions, and then when we finish the presentation, we'll go ahead and we will announce all those questions out loud, and then the doctors will answer your questions. So if your question is not answered by us, we will get back to you individually. And so please be sure to enter your questions as you see the subject come up. Okay, well, let's get started with our presentation. Dr. Novak's going to lead us off tonight.
Okay, great. Thank you, Sarah. Thanks for everyone that joined the webinar. We're excited that you're all here. We're just going to talk a little bit about breast surgery and breast implants. And I presume, this was a breast implant webinar. So, I imagine the majority of the participants are possibly thinking about breast implants or interested in breast implants, but there are a variety of other breast procedures that we perform as board certified plastic surgeons. So we'll talk a little bit about that too. Really, one of the things we're going to try to do a little bit tonight is, just educate you about what the options are as far as breast implants and the different types of implants, the different placement techniques. And really, that all begins and just stresses the importance of having a consultation with a board certified plastic surgeon. And so, what will happen, when you schedule your consult is you'll meet with either me or Dr. Mason, and you'll have the opportunity to discuss kind of what your goals are, what you like, maybe what you don't like. Talk about your past medical history, any past surgical history that you may have, and then really kind of discuss what the options are and how we can best get you to your goals and make sure we're able to meet the expectations that you have for the procedure. So what is breast augmentation? Well, breast augmentation is a procedure that we perform to add volume or enhance the volume of the breasts, and then really put the volume where we want it in the breasts. And so for a lot of women, that may be upper pole volume or adding volume above the nipple and areola. Candidates for that there's a wide range of women who are candidates for that. And it may be a woman who never really had the volume of breast tissue that she was interested in having. And so in those cases, it may be someone before they have kids that might be interested in breast augmentation. But then we also see patients quite a bit who have had a pregnancy or two, or maybe even a few, and have lost volume after having a pregnancy. And so those patients are great candidates as well for breast augmentation. And then there's a variety of techniques that can be used to place breast implants. And one of the kind of key technique distinctions is the plane in which the breast implant is placed. And so there are three main plane placements. And so you may have heard of under the muscle or above the muscle. And so we call under the muscle a submuscular placement. And then there's two different planes on top of the muscle. You can put it underneath the fascia, which sits just directly on top of the muscle, or just below the glands or the breast tissue itself. And there's a variety of reasons why one patient may be a candidate for one of those placement techniques versus another. It also has a lot to do with your goals. It also has a lot to do with the implant that's selected. And so, again, just kind of stresses the importance of meeting with someone who's an expert in breast surgery, breast augmentation, and particularly a board certified plastic surgeon like Dr. Mason and myself. And so, there's a new and exciting placement device that's available that we have here at South Lake Plastic Surgery. It's developed by the company Motiva, and it's called the Motiva Preserve breast augmentation device. And so this is a device. I actually have one here that I can show you. So this is a device that we use for breast augmentation, and a small channel is made through a smaller incision than we would typically use for breast augmentation, about 3 centimeters in the fold underneath your breast. And so this device is placed into that small incision, and then this balloon is expanded underneath the breast tissue, and at which point the balloon is deflated, and then we can insert an implant up to about 320 cc's or so. The nice thing about this technique is that it can be done with less anesthesia than some of the traditional breast augmentation techniques. And so there are patients that have had this procedure wide awake. There are patients that have some light sedation for this procedure. So for that reason, patients typically bounce back a little bit quicker. It's also a little bit less painful than some of the other breast augmentation techniques. And so if patients are looking for an implant that's 320 cc's or less and are interested in maybe not having general anesthesia, I think this is a great option for those patients. One other thing that's great about this procedure is the technology of implants that we now have available. And so Motiva has developed these ergonomic implants that give a very natural result when placed on top of the muscle. And so they assume that teardrop shape when placed on top of the muscle, and so give a very natural result. And I think it's a great option for patients that lead an active lifestyle and are interested in that implant size up to about 320 cc's or so. So definitely a very interesting technique, and we're excited to be performing it here at South Lake Plastic Surgery. And then, there are a variety of other implant types that are available. We have all of the implant manufacturers at our disposal here at South Lake Plastic Surgery. So there are three main manufacturers in the United States, and two of which are listed on this slide. So Allergan or Naturel implants, the Motiva implants, which I just spoke about. And then there's a third company called Mentor that we occasionally use as well. But primarily, we use these two you see here on the slide. All of the manufacturers are completely safe. They're all FDA approved in the United States. And they all have a range of cohesivity, which is firmness of the implant. And so that firmness really is what kind of gives you that upper pull volume. So a more firm implant is going to maintain its shape more in the upright position. And so that, as you see here on the slide, is going to give you that more rounded appearance to the breast. Versus the softer or less firm, less cohesive implants are going to assume a bit more of a teardrop shape in the upright position, and therefore give you a little more natural appearance to the breast. So again, kind of depends on your goals. And then this also kind of goes back to what I was talking about with the implant plane. You can imagine that if you've got your pec muscle on top of the implant as well, that's also going to give you a little more slope to the breast, just because there's more tissue between the implant and the outside world to camouflage the upper edge of the breast implant. So again, these are all things that we can discuss during your consultation. No two pair of breasts are the same. So And no one's goals are the same either. So, it's really every time we sit down with a patient, it is truly unique, and we try to tailor the treatment to exactly what your goals are and make sure that your expectations are met for exactly what you're looking for. And so, we do primary breast augmentation, which is where a augmentation occurs through that incision, like we talked about. We place an implant, and that's it. That's called a primary breast augmentation. And then occasionally we'll do implant exchanges for women for a variety of reasons. And one thing I like to talk to patients about is that the average lifespan of an implant is around 15 years or so. Sometimes I see women back a little bit sooner than that, wanting an exchange or a touch up for one reason or another. And then occasionally I'll see women who've had their implants for 40 years or are having no problems with them. So everyone's a little bit different, but sometimes women, after a while, maybe the capsule around the implant gets a little bit hard, and that can happen to varying degrees in different women. That's called capsular contracture when that happens. And so that's one common reason that we'll make adjustments to the implants. So this patient that you see on the left of your screen here had some capsules that formed around her implants. And so she was looking for a little bit more natural result and softer feel to the breasts. And so she had an exchange where the capsules were removed and the implant plane was changed. And so it gave her a much more natural look and kind of softened the implants for her. Also improved the symmetry between her breasts quite a bit. So, and then the patient on the right of your screen, this is kind of almost an opposite problem of what the patient on the left side of the screen had. So this patient had what's called bottoming out, where the implants had descended quite a bit. And so for this patient, I did what's called a limited incision breast lift, where I removed a little bit of skin below the nipple and areola on each side, and that allowed me to even things out, get a little better symmetry. I also did what's called a periareolar mastopexy or breast lift, where there's an incision just around the areola. So she doesn't have a vertical scar on her breast there, but allowed me to get much better symmetry between the implants, her nipple and areolas, and then also get the implants sitting higher on her chest wall to give her a little more cleavage in low-cut tops or in a swimsuit. So these are the kind of things we can do when we're exchanging implants to kind of touch them up or make improvements to, the size of the implant, the position of the implant, or how the implant feels. And so now I'm going to turn it over to my partner, Dr. Mark Mason. He's going to start out talking about breastosis, and then he's going to have a few other topics he's going to cover.
Hello, everybody. Thanks for joining us tonight. We appreciate you taking time out of your busy schedule to be with us. I wanted to talk just for a minute about breast sagging. The medical term for that is ptosis. A lot of patients that come in think they just need an implant, but if their breasts are kind of sitting low on the chest wall, they may need a lift as well as an implant. This picture shows basically what a normal breast looks like, where the nipple is well above this crease underneath the breast. That's called the inframammary fold. And then stage or grade 1 ptosis, the nipple's down just a little bit. Grade 2, the nipple is below that crease. And then grade 3, the nipple is basically at the lowest point it could be on the breast. If you have a grade, or, I mean, normal or grade 1 ptosis, you might be okay just with an implant. But if you have grade 2 or 3, you're probably going to need a lift as well. Because if we put an implant in and you have significant drooping, then the implant's it'll make you bigger, but it's going to sit at the lowest point in that pocket. So you'll be bigger, but you'll still be low. And most patients don't want that. The way we address that is by doing a breast lift. And the breast lift is called a lift, but it's more of a push-up procedure. There, there are several different kinds of lifts. Basically, every lift requires an incision around the areola. So the because the nipple areola needs to be moved up, and also a little bit in towards the midline, because the chest wall is round. So when breasts fall, they kind of fall down and out. A traditional lift requires an incision around the areola and then a vertical incision underneath, and then often one in the crease as well. Some people call that the anchor type incision. Just as a side note, if you go on our website and click on breast lift, you'll see some really nice 3D animations of how the procedure works. Because it's confusing to just look at pictures and try to figure out how this all works. Sometimes patients can get away with just an areolar incision and that vertical one down, but often they'll need an incision in the crease as well. This is a nice um, pre-op and post-op picture of a woman who had implants and then a traditional breast lift. You can see the faint scar around her areola and then the vertical, and the other scar is hidden in the crease. If you just do a breast lift without an implant, you're going to end up being a little bit smaller. So it's important to try to figure out, do I want to be smaller? Do I want to be lifted but same size? And so those are the things we would talk about during the consultation. This patient also had a great result from a tummy tuck. So kind of the smallest type of lift we do is called a areolar lift. And you can see the incision around the areola on the patient, the second picture from the right and the fourth from the right. That procedure will give you about a 1 or 2 centimeter breast lift, but it's not going to give you a huge amount of lift. So if your breasts are significantly droopy, then you're probably going to need one of the other type of lifts in addition to the periareolar lift. Another thing we do breast lifts for often is breast asymmetry. And there's really no such thing as perfectly symmetric breasts. There's an old saying, breasts are sisters, they're not twins. But our goal is to try to make them be sisters that look a lot alike. So this young lady had significant drooping on her left breast, and the right breast was really in pretty good position. So she had an implant done on both sides, and then a kind of a small volume lift on the left side. I think she got a great result. So I've been practicing here for 26 years, and a lot of my patients are coming back now to talk about breast implant removal or placing a smaller implant instead of the one they have. We all know that with age, sometimes we gain weight. Also with just genetically, sometimes the tissue doesn't hold up as well. So the breast tissue can sort of slide off of the implant. And other reasons for breast implant removal or exchange is just patients are tired of them. They want to just take them out and not worry about it. If you have a really significant size implant, you're probably going to need a lift when we take them out. If you have a small implant, you may be fine just by taking them out. And we would do some measurements when you come in for a consult and then talk about that. Some patients don't ever want them out. The thing about implants, they're not going to last forever, so you'll have to change them out at some point, but you don't have to remove them. That's just a personal choice.
Great. So thank you, Dr. Mason. That was great. And then on the next slide, we have a recording from one of our post-operative nurses, Samantha, and she's going to discuss the expected recovery after a breast procedure. And so, with the range of procedures we do, augmentation, reduction, lift, and the different types of lift, there's commonalities to the recovery process. And so she's going to go over an expected recovery process.
Hi, my name is Samantha, and I'm one of Dr. Mason and Dr. Novak's clinic and OR nurses. Today, I'll be going over expected recovery. It's normal to have a ton of questions and concerns regarding your surgical journey. One of the most common is post-op pain management. In order to address this, we utilize an advanced multimodal regimen that targets pain from multiple angles in order to keep you as comfortable as possible, while also reducing reliance on narcotic medications. Another major focus is reducing uncertainty. We do this by providing multiple touch points for comprehensive education, as well as providing personalized recommendations on things like garments, scar care, activity restrictions, and when you can get back to your lifestyle. Most importantly, we want our patients to know that they have a team behind them. Through direct access to our nursing team, as well as regular follow-up appointments, we're able to answer questions and provide the ongoing support that you need to feel confident and comfortable in your recovery journey.
Great. And Samantha's awesome. We have several other nurses and office staff that you'll have full access to, both leading up to surgery and after surgery. I like to tell my patients, like once you've signed up for surgery with us and had surgery, you're in the club. So, you really truly like have access to myself or Dr. Mason to make sure that, we get you across the finish line, get you to, your goals, and make sure that it's a phenomenal experience the whole way through. And we really pride ourselves on being able to provide that for patients. So on the following slide, you'll hear another pre-recorded message from Kim Kolar, who is our patient care coordinator, and she's going to discuss the booking process and some of the different options with regard to scheduling and financing of these procedures.
Hi, I'm Kim Kohler. I am Dr. Novak and Dr. Mason's patient coordinator, and we're so happy that you're here with us tonight. I will be meeting with you also along with the doctor during the consultations. I'll be going over the quotes. We'll talk about payment plans and scheduling. So, I can't wait to meet you. And for attending tonight, you guys are going to get a complimentary consultation. You just have to schedule that consultation by August the 30th. And for the first 20 people that schedule those consultations, you're going to get a surgery fee reduction, which is 10% off of the surgeon's fee. And you'll also be entered into a drawing. 5 people could get waived implant devices, so implants. They have a value for up to $1,500. Skincare product package worth $400 and a med spa gift card worth $200. And we'll do those drawings the next day on Wednesday on social media during lunchtime, and we'll contact you if you win.
Sorry about that. We're having some technical difficulties here. Let me see if I can get the next slide going here. Oh.
We had a pretty severe storm that just passed through here, so some of us are losing our internet connection, which is what's happening. So we apologize. It's probably us, not you.
Um, Sarah, while I'm working on getting the last couple slides, I think there were just a couple left. Do you want to open it up for question and answer while I'm working on getting these going
Yes,
again?
of course. Absolutely. So if you do have a question, go ahead and enter those questions in the chat box or in the Q&A at the bottom of your screen. And let me see if I can pull some of those up here. I do have a couple of questions already. What is the difference between the implant being below the muscle and on top of it, besides just the term under or over the muscle. Dr. Mason, do you want to address that?
Sure. So when we say under the muscle, we're talking about the pec major muscle, which is the major chest wall muscle here. And under the muscle is kind of a misnomer because the implant is only partially covered by the muscle. In some patients, if you're really thin, don't have a lot of breast tissue, we prefer under the muscle because our goal is to maximize the amount of soft tissue coverage you have over the implant. So in that case, it's better to go under the muscle.
Okay.
If you have enough breast tissue, if you think about it, a natural breast sits on top of the muscle. It's not under the muscle. So if you have enough breast tissue and you're a good candidate, often we'll put the implant on top of the muscle. And that's what Dr. Novak was talking about a while ago, that there's a subfascial plane, it's called. Fascia is this thick covering over the muscle, so it's possible to lift that up and put the implant under it. In other patients, it's better to leave the fascia attached to the muscle, just put the implant under the breast tissue. Those are the major differences. And some people really worry that the under the muscle recovery is going to be so much worse, but basically they're both fairly quick recoveries.
Okay, thank you so much. We're going to have Kim go over some of the payment options that we have here at Southlake Plastic Surgery because I know a lot of people do have questions about that as well.
Hi, everyone. So my slides got a little messed up, but I can go ahead and kind of talk about what was on them. One thing that we do offer are some great payment plan options. We work with some companies like Care Credit, Patient Fi, and Cherry, and all of those are on our website. You can go to our website and, click on the links and kind of explore those options. But we do have an exclusive offer from Patient Fi for everyone that has been on the webinar. They are offering 18 months with no interest. And this is a special, offer that they're doing just for the webinar people. All of them do offer a 6 and 12 months no interest, which is wonderful and which can help pay for these surgeries. But we will go over that during the consultation. And again, you can find all that information on our website. And then as far as scheduling your consultation, so tomorrow, if you are interested in coming in to talk to Dr. Mason or Dr. Novak, you can give us a call. And there looks like our little screen is up. Maybe go to the next one, Dr. Novak, and yeah.
Yes, I don't think we're gonna get let's see. Let me stop screen sharing.
It's like it.
There we go. I don't think that your video is going to play though in this. I was able to get the old version.
That's fine. And that's one of the partners that we have there. Can you make the next slide come on as far as the scheduling? Perfect. Exactly. So tomorrow, if you'd like to schedule a consultation, you can certainly go onto our website and you can book online there. Or you can call us, and you see the number there at 817-442-8900. Again, the consultation will be complimentary. We just have to put a valid credit card down. We will not charge it. We just need you to let us know if you can't make it for any reason within a 48-hour period. Otherwise, we will charge the credit card. But we would love for you to come in and see us and learn more about the procedure that you're wanting to have done. That's it.
While we're waiting for the next slide to come up, there's another question that I had received prior to us even starting, and they said, when would lifting, if you're exercising, when would lifting at the gym be allowed after breast augmentation or a breast lift surgery?
So we like you to rest your chest muscles for about 6 weeks after surgery. Um, you can do many other exercises. You can do cardio, you can do light weights, but any heavy lifting where the pec muscle is engaged, we like you to wait for 6 weeks. After that period, you don't have any restrictions, so it's not going to basically keep you from doing anything you want to do later. We just want you to heal. If you do too much early on, you just get more swollen. It just takes a lot longer to heal. So 6 weeks is the magic number.
Okay, thanks. All right, and I think you guys want to discuss the myths that a lot of people are seeing out there on social media. Do you want to start addressing those?
All right, I'll take the first one. One thing that's important is hopefully you'll get most of your um, data information or facts from reliable sources. Sometimes social media is not the best place to get the answers to your questions. So, talk to a plastic surgeon, talk to us, or go on a website that's legitimate. Like the breast implant companies all have really nice websites, or just call us and we'll talk to you about it. So breast implants don't have an expiration date. As Dr. Novak said, the average lifespan is about 15 years. But like knee replacements or heart valves, at some point you're going to have to redo them. But that 15 years is all based on a bell curve. So some people get 20, 30 years, some people get 8 years. Hopefully you'll be one that gets many years out of yours. So they don't expire at 10 or 15 years. You don't have to come in and get them exchanged on that date, only if you're having an issue. So silicone implants do not cause cancer. Breast implants are the most studied implant to ever be placed into a human being. Once again, more than joint replacement um, hardware or pacemakers or heart valves. They're extensively studied and they've never been shown to cause breast cancer itself. There's an extremely rare condition called breast implant associated ALCL. It's this very rare lymphoma found in the scar tissue around the breast implant. I think there's about 1,200 cases worldwide, and that's out of millions of implants. And it's only been associated with these implants with these really roughly texture on the outside. And for that reason, we don't use those implants. So I think they're extremely safe. As far as mammograms, any um, good mammography center knows how to do a mammogram with implants. So they have these special views where they sort of push the breast implant out of the way and image your breast tissue. So there should be no problem in you getting a decent mammogram with implants. All right.
Awesome. And then a few more. A common question we get is whether you can breastfeed after getting breast implants. And the simple answer is yes. There's no reason, regardless of the plane that the implant is placed in, that a woman couldn't breastfeed after getting breast implants. That being said, it could potentially cause some issues. And, what I like to tell my patients is that there are women that have difficulty breastfeeding even in the absence of breast implants. So, if the ability to breastfeed is extremely important to you and maximizing your ability to breastfeed is extremely important to you, we can talk about that. It's something you definitely want to make sure is known about you before undergoing a procedure. And so that's something you'd want to bring up during your consultation. But there's no reason that you couldn't breastfeed after breast implants. And so it's something we can talk more about in more detail to make sure that you have the greatest chance of success with breastfeeding in the future. And then another myth is that you can't work out or live an active lifestyle with implants, and that's just simply not true. And in fact, like, extremely active women have breast implants, from gymnasts to bodybuilders, and then just for regular weightlifting, travel, swimming, all the activities that you could imagine you can do with breast implants. I saw something like come across social media recently that someone was saying they were worried about getting in a sauna with breast implants. Also, just kind of very silly rumor or myth on social media. The temperature rating for these breast implants far exceeds the temperature at which you could survive. So if you're okay in a sauna, then your breast implants will be okay in a sauna. So there are some distinctions when you have the implants either on top of the muscle or under the muscle with regard to maybe a little bit of movement when you're contracting your pec muscles. So if if you are leading a really active lifestyle and you want to avoid having any of that movement of your implants with exercise or certain motions, that's something we could discuss and customize your implant plane for that reason. So and then finally, implant rupture is a medical emergency, another myth. With the 5th generation silicone implants that we have nowadays, they're a highly cohesive silicone gel. And so you may have heard of them referred to as gummy bear implants. And the reason they got that term is because just like a gummy bear, if you were to cut the implant in half, it doesn't just ooze all over the place. It maintains its shape. And so little punctures or a crack in the implant oftentimes go undetected, and we call that a silent rupture of the implant. And so it doesn't really cause problems. It doesn't make you sick. If it's incidentally noted on a mammogram, there are a variety of other things that we would check during a consult and examination to see whether the implant should even be replaced, whether it's worth doing anything about. And there's a variety of factors that would play into that. So if you're concerned about your implants or you think they may be ruptured or you were told during a mammogram that they're ruptured, it's great to have a consultation and we can talk about what the different options are, but it's certainly not a medical emergency to have them replaced.
Great, thank you. We do have quite a few questions that have come through now. One question is that if you have an inverted nipple with current implants, can replacement implants help with that? Dr. Mason, would you like to answer that?
Yes. So inverted nipples are caught, the little tubes, we call them ducts that carry milk out the nipple. An inverted nipple is caused when those ducts shorten and they kind of pull the nipple in. And usually just changing an implant out is not going to totally take care of that. There's a very small procedure you could do at the same time where we go and make a little incision at the base of the nipple and release those ducts so that the nipple comes out. That's a more reliable way to fix it. However, if you do that procedure, that would decrease your ability to breastfeed in the future. So those are things we would talk about.
Okay, thank you. This next question I think is going to be for Kim. One of the questions is, can you give pricing ranges on pricing for a breast lift and implants?
So that procedure runs between about $13,000 to $15,000, depending on the type of implant. And again, that's why the consultation is so important because everyone's a little bit different. But that's kind of the approximate price. That includes surgeon fee, operating room, implants, and anesthesia.
Okay, thank you. We have a question about breast reduction. We didn't really talk about breast reduction, but the question is, what is the theory on using drains versus no drains? And speaking of drains, do you use drains for other types of breast implant surgery as well? Dr. Novak, would you like to answer that?
I think there's quite a bit of variability in the use of drains among surgeons. There have been a few large studies that have demonstrated that there's not really a huge difference with breast reduction in whether drains are used or not. So I do not use drains with a breast reduction. And in fact, really, the only time I use drains with breast surgery is if I'm removing implants and not replacing implants, just to prevent fluid from accumulating in that space where the implant used to be. I think Dr. Mason's similar with maybe some small nuances. But no, I do not use drains for breast reduction. In fact, I rarely use drains in breast surgery. So
thank you. The next question is from someone who is replacing their implants that are above the muscle and they currently have capsular contracture. We didn't really talk about capsular contracture tonight. Could that be the next surgery to go under the muscle, and what are the chances that contracture would happen again? Dr. Mason, you want to answer that?
So capsular contracture is a condition it's rare, but it's the probably the last thing with breast implants we don't totally have figured out about how to prevent it. If you develop capsular contracture, we have to go and change the implant out and remove that scar tissue. And it's certainly possible, and probably we would like to change the pocket location. So if you had them on top of the muscle, going under the muscle would be a good idea. Um, the problem with capsules is that once you develop capsular contracture, you're a little higher risk for developing it again. But changing the location of the implant, like from on top of the muscle to under the muscle, is one of the best ways that we can decrease the risk of it coming back.
Okay, thank you. Let's see, the next question asks, can this procedure be paired with another procedure? So I'm assuming either breast augmentation or breast augmentation and a breast lift. Can it be paired with other procedures? Or was
Yeah,
it together, either
the
way?
answer is yes, absolutely. Yes, we commonly combine procedures of the breast. So breast lift, breast augmentation, we commonly combine those. There's a few times where I like to do what's called stage those procedures, where I do them separately, but those are really the exception, not the rule. So, if we could discuss that during consultation. But yes, I commonly perform those procedures, but also other plastic surgery procedures like a tummy tuck, liposuction, some smaller facial rejuvenation procedures. And both Dr. Mason and I operate head to toe. So, you know, if you were interested in combining procedures, it's very likely that we perform any of the elective plastic surgery procedures that you might be interested in.
Okay, great. Thank you. The next question asks, are there issues with placing implants for someone who has really dense breast tissue? Dr. Mason, I know you've had
The
several
answer,
cases of
right.
that.
The answer is absolutely not. There's no problem. What we see often is that younger women have more dense breast tissue because breasts are made out of the breast gland, which produces milk and also fat. As we age, we get to be my age, the breasts are um, mostly fat, but at a young age, they're mostly breast gland tissue, which is denser. And it is no problem at all to do a implant with dense breast tissue or a lift or a reduction for that matter.
Okay, thank you. Another attendee has asked, can you sleep on your stomach after healing? Dr. Novak, can you answer that for her?
Yes, you can. You can sleep on your stomach. You can sleep however you sleep before surgery. I do require that patients wait about 6 weeks before progressing to really high intensity exercise or sleeping in positions on their stomach. And the reason being, a capsule that forms around the implant is a normal part of healing. And so that capsule, it should be soft, pliable, but we do want that capsule to form because we want that implant to really stay in about the position that we place it. And so that capsule forms and it strengthens for about 6 weeks after surgery. And so we just really want you to kind of avoid doing anything that would really displace the implants, like laying on your stomach or running or lifting heavily, with your upper body for about 6 weeks so that that capsule forms and the implants stay about where they are. And that's will help us avoid that issue that women occasionally have where maybe if they lay on their back, the implants kind of fall to the sides. And so that's really the purpose of just making sure you're completely healed. But yes, you can totally go back to all the activities and sleeping however you'd like after breast augmentation.
Thank you. Another attendee has asked, what could cause an implant to rupture? Dr. Mason, can you answer that?
Again, so breast implants are extremely sturdy. I've had a patient put an implant on the floor before and stand on it just to see if it would pop, and it didn't. the theory, here's an implant right here. The theory is if you have a fold in the implant, this is called the shell, the outside. So if the shell has a fold in it and that fold rubs on itself over and over and over and over months or years, that potentially the friction could cause a hole to develop in the shell, and that could lead to the implant leaking. But I've had patients in car accidents, motorcycle accidents, many types of major trauma, and their implants were fine. So it's not usually related to any certain event. It's just sort of normal wear and tear over the years.
Okay, thank you. And then another attendee has asked, do you have to wear a bra all the time after surgery in order to keep the results from changing? Dr. Novak, can you address that?
Yes. And the answer is that you don't have to wear a bra all the time. Certainly, if there's like a certain dress or like, swimsuit, obviously a swimsuit that you wanted to wear that is not supporting your breasts, that's totally fine. It's just, the more you can support your breasts after having a breast augmentation or breast lift, the more longevity you'll get from that procedure because unfortunately we live on planet Earth and gravity affects all of us, and so over time, gravity and the aging process continue to affect our breasts. And wearing a bra is just really one of the best ways that you can counteract those effects. So that being said, we have to live our lives. And so, as I said, if there was like a top or something you wanted to wear, it's not to say you can't do that. And we can't just like saran wrap ourselves so that we stay, in the same position for the rest of our lives. But certainly you can go without a bra. A lot of patients stop sleeping with a bra. And living a healthy lifestyle also, diet lifestyle is also very helpful.
Okay. And Dr. Novak, I'll have you answer this one. Is the Motiva implant surgery under local anesthesia, is it cheaper than a regular breast implant surgery since those are usually done under general anesthesia?
The anesthesia, if you truly do it under local, that does reduce a significant portion of the anesthesia cost of the procedure. There is the device that is included with a portion of the pricing for the Motiva implant. So depending on whether you wanted sedation, not having sedation, the price is similar to a traditional breast augmentation. But I don't think it's certainly not like much less because it is a novel technique and I think it's less painful, less downtime. So I think that there are a lot of patients that are interested in that, and so for those reasons it's either about the same or maybe a little slightly more.
Okay, thank you. And then there is another question about the infection rate of implant surgery. How do you reduce the infection rate? Because if you're touching the implants when in surgery, or do you use any kind of method that helps reduce the infection of breast implants?
Right. To have an actual breast implant infection and have, get an abscess and a fever and have it removed is extremely rare. It's way below 1%. And the reason is I think our techniques have improved over the years. First of all, before the surgery starts, you get a big dose of IV antibiotics, and that helps. And then when we do the implant pocket preparation, of course, we use sterile technique. And when we put the implant inside the pocket, we use something called a no-touch technique. We have kind of this sleeve device that looks like a funnel, or those devices that bakers use to squeeze icing out on a cake. So we put the implant in there. We call it a funnel, and that goes inside the incision, and then we push the implant inside, so the implant never touches the skin or anything outside of that. So we have a good techniques to prevent infection, and luckily it's extremely rare.
Okay, thank you. And I think we've answered this question, what is the lifespan of the implants, and do each type of implant have a different time frame before needing to be replaced? I believe you've touched on that, but could you also talk about a little bit about the warranties that most implant companies offer? Dr. Novak, do you want to answer that one?
Yeah, so there's similar warranties amongst the implant companies, and so usually we can get a rupture covered, where they'll cover the replacement costs of the implant device. And then there are other warranties with regard to other issues that can happen with the implants, like when that capsule forms around the implants, or you get a harder capsule that forms around the implant. The implant warranties are very similar between companies, and again, important to go to a board certified plastic surgeon, and that's one thing that we pride ourselves on here at South Lake Plastic Surgery is, once you trust us to be your surgeons, we really like to take care of our patients. And if you're ever having any issues with the procedure, we just want to make sure that, all of your expectations are met, and, that you have an excellent result and a long lasting result.
Okay, perfect. Well, it looks like most of our questions have been answered. Again, if you want to ask us something and you've thought about it, you think about it overnight, you can email or text or call us. If you aren't a current patient and you text us, please give us your name so that we can give you a call. We do have to have your consent before we can text you back. And as you can see on this slide, our text number is 1-877-682-4644. So you can text us at any time. We do not monitor those after hours, but we'll see it first thing in the morning and we'll get back to you. We like to try to get back to you within 12 hours. And then you can always email us at info@southlakeplasticsurgery.com. You can also call us at 817-442-8900. We do have a QR code here on this slide as well, where you can just scan it with your phone, with your camera, and you can schedule your consultation. Again, you're going to be asked for your credit card just to hold the consultation, but it will not be charged because as an attendee, you are getting a complimentary consultation that would normally be $125. Kim, did you want to clarify? I think there was one mistake on one of the slides, and if you want to clarify the 10% surgery reduction discount?
Yes, so the 10%, the 10% surgery discount is for the first 20 people who schedule surgery. So it's not just the first 20 people that schedule consultation. So you have to be the first 20 that schedule your surgery by August the 30th, and then you will receive the 10% off the surgeon's fee.
If you have any questions, please feel free to reach out to us. Of course, during your consultation, both Dr. Mason and Dr. Novak will spend quite a bit of time with each of you, and then you will meet with Kim afterwards, and you can ask her even more questions. And almost anyone who answers the phone can help you as well. Our nurses are very, very well versed in all surgical procedures and all the pre and post care regarding all of the surgeries, including breast surgery. And then all of our office staff is very helpful. They're all helpful as well and can get you to the right person if they can't help you. So we just really appreciate you all being here tonight, and I apologize for the technical snafu. I think we all have our Wi-Fi up and running again, and we hope you all learned something new. And if you're not currently a patient of ours, we would love to see you and meet you, and I hope you can join us as part of our South Lake Plastic Surgery family. Again, tomorrow we're going to be drawing all of our winners for the prizes. So we will do that around lunchtime, and then we will post it on social media, and you will be contacted individually. So is there anything else I missed? All right. Well, thank you so much for being with us tonight. We hope you learned something new. We hope to see you soon. Bye-bye.
Thank you.
Bye-bye.